Hello, colleagues, and welcome to today's session of the Annual Forum 2026 of the Scaling Community of Practice. I am Tendai Gotora from SPARC Health Africa, calling in from Zimbabwe, and I am co-chair of the Health Working Technical Group with Dr. Mojisola Odeku from Nigeria and Laura Giron from the US. Before we begin with the main topic of today's session, let me give you a bit of background. The Scaling Community of Practice is now in its 11th year. It has grown from about 50 members in 2015 to over 5,000 members. Everyone is free to join. Please do check out our website if you're not already a member. The Scaling Community of Practice is a network of development and climate practitioners and experts who want to learn about and contribute to the scaling agenda. That is helping to achieve sustainable impact that matches the scale of the problem. The Scaling Community of Practice has 9 working groups, of which the Health Working Group is one. The community publishes reports on the scaling experience of its members, including in regular newsletters. It produces its own knowledge products, which you can find on the Scaling Community of Practice website. And it organizes its annual forum events to exchange scaling knowledge and promote action. This year's 2-week forum marks a significant milestone for our community, the official launch of the Scaling Campaign 2026 to 2030. This is a collective effort to strengthen the systems, standards, and partnerships needed to make transformational scaling the norm across development and climate ecosystems. In the working group sessions, we're reflecting on how scaling works in each of the working group sectors and thematic areas, and how all you can contribute to the goals of the scaling campaign. Please join as many of the sessions as you can, and especially the last session on Friday, 6 March, when we will summarize the main takeaways from the forum and issue a call for action to support the scaling campaign 2026 to 2030. These sessions are being recorded. We hope that you share these sessions once uploaded online with your Francophone colleagues, as the session recordings will be translated into French and Spanish. Please note that all speaker bio sketches will be placed by my colleague Gabby in the chat as they start presenting, starting with the one of our moderator, whom I'll introduce shortly. Now, let's turn to the topic of today's session. I am truly excited about today's discussion, focused on 2 key areas. First, hearing directly from ExpandNet associates about their hands-on experience supporting country teams to use the ExpandNet WHO frameworks. And second, getting a first look at a major new resource designed by ExpandNet to help us do this work better. That is the Scale Up Learning Center. And now it is my pleasure to introduce you to our session moderator, Dr. Jeanette Honkanrin. Dr. Jeanette, over to you to take us through today's session. Thank you.
Thank you so much, Tendai, and good afternoon, good morning, good evening, depending on where you are. I'm so glad to be moderating this engaging session where we will focus on the benefit of applying ExpandNet frameworks and tools, but also having some key learning from country experience from Nigeria to Kenya and Pakistan. And I'm also excited that we will have a chance to hear about and preview ExpandNet's forthcoming Scaling Up Learning Center, SLC, which is an online curriculum and collaboration platform that is still under development. But to get us warm up for the session, we wanted to ask you to participate in creating 1 or 2 quick word cloud, since we would like this session to be both interactive and practical. Therefore, your active participation is highly encouraged throughout the panel, using the chat box, but also, when we will be joining the breakout room, we'll be happy to have you there. I'm now going to ask Gabby Montalvo, who is supporting us on the COP team, to launch our first word cloud, where you should see the prompt and a response box on your screen for the question, for the first question. The first question will be, what does the term scaling mean to you? In one or two words, what does the term scaling mean to you? Please just take a few moments and submit your response to that box. Of course, there is no right or wrong answer. Just share anything that comes to your mind based on your experience, based on your perspective. So let's get typing now. I hope everyone can see the screen, on his screen, can see the prompt. I should be now seeing some response right now. Wow, this is really great. Geographical expansion, impact, expansion, greater impact, increasing reach, reaching more people. Great. I think those are the things that really speak to the scale up as we are going to dive into that during the session. We can see that the participant, it's not like we are preaching for people that are already convinced, but anyway, I think this is coming very well. Now, since we still have some time, let me go back to the next question. Gabby, can we have the next question, please, on the screen? The next question will be, what is one word to describe the state of scaling up, to describe the state of scaling knowledge and implementation in your country or in your field? Same process. Just type anything that resonates for you. Okay, start coming up. Insufficient, limited, okay. More fragmented, okay. Low progress. I can see things that are coming up here. Thank you so much for putting those here. Good in theory, okay. Buzzword. Good to see some of those things, okay. We can see there are some good movement across the scale up, but there is also so much that still remains to be done. This is very helpful entry point for us, actually, as the panel will be focusing on some of the issues and some of the points that you have mentioned on the word cloud. Thanks so much for doing this with us. Now, I would like to invite, thanks so much for the word cloud. I think we can close the poll for now. Thank you, Gabby. Next now, I would love to invite our first speaker, Laura Giron. Laura is a long-term advocate of scaling up. She's the one that brought me to the scale up. She shifted my mind about scale up, so really, she is a founding member of ExpandNet's and the president of Partner in Expanding Health Quality and Access. And Laura will give us a brief introduction to the ExpandNet approach. You see her full bio in the chat. Thanks for that. So without any transition, over to you, Laura.
Great. Thank you so much, Jeanette. It's such a pleasure to be on this panel with this amazing group of senior leaders, all of whom are deeply committed to ensuring that scaling up becomes the new norm. So all of today's presenters, including our moderator, Jeanette, serve on ExpandNet's Global Advisory Council. And we're delighted to share our experience with you. And we hope the session inspires you to learn more and perhaps even join ExpandNet. So thanks for the slides, Gabby. I'm going to take control of them. And start with this one, which is ExpandNet members are really united in the recognition of the problem reflected in this quote, namely that the power of health interventions is not matched by the power of health systems to deliver them. And this can be said across development sectors. Probably everyone here, as evidenced by the word cloud, is struggling with the evidence to practice gap. And many around the world have found that the ExpandNet WHO scaling up framework and guidance tools can be helpful in addressing this problem head on. Since our founding in 2003, ExpandNet's goal has been to help people everywhere work more systematically, strategically, and effectively on scaling up. For those who aren't familiar with us, let me share a little bit of background. And I need to advance my slides, sorry. A lot of buttons. So for more than 2 decades, ExpandNet has functioned largely as an informal global network of professionals advancing both the science and practice of scaling up. Initially, and still for many of us today, our focus has been on reproductive health and primary health care. But over a decade ago, we began collaborating across other sectors, including education, water and sanitation, environmental conservation, agriculture, and more. And as you can tell from the map, ExpandNet WHO guidance has been applied to advanced scaling work across dozens of countries with a wide array of governmental, non-governmental, and donor partners. Scaling up, taking you back to when this journey began for ExpandNet, ExpandNet members recognize that it's predominantly an organizational, managerial, political, and institution building task, rather than narrowly a technical one. This means that a technically well-prepared team, for example, doctors and nurses, won't automatically have the skills needed to ensure that scale-up proceeds effectively. We also noted that ad hoc approaches to scaling were not working, and that instead, systematic planning was required. Back then, we also noticed that there wasn't one all-encompassing definition of scaling, so we decided to create our own, drawing on experience of our founding members and an extensive literature review we did in the early 2000s. Since then, we've continued to curate the scaling literature and make it accessible through our searchable Scaling Up bibliography on our website at expandnet.net. ExpandNet's definition of scaling up has been widely adopted across many different fields and institutions. It reads, deliberate efforts to increase the impact of innovations successfully tested in pilot or experimental projects so as to benefit more people and to foster policy and program development on a lasting basis. Now, I could unpack the definition in detail, but I won't, because you can read about it on the guidance in ExpandNet guidance on our website. But I will address the idea of deliberate efforts, because on the one hand, while scaling up isn't rocket science, on the other, it's very different from the way things are typically done, whether in the public or nonprofit sector. Therefore, ExpandNet saw a need to build scaling capacity at country levels, an objective that led us to develop practical guidance to support implementers. The guidance we developed maps onto 3 distinct phases of a systematic scaling trajectory. Our goal is to help leaders use existing knowledge about what makes scale-up succeed to shape their work. Ideally, this begins from the earliest phase of project design and testing, where the ExpandNet WHO guidance, beginning with the end in mind, planning pilot projects and other research for successful scaling up, has proven immensely helpful. Dr. Harris will soon share with you some key learnings and results from the SCoP initiative, where his team used this guidance to greatly strengthen their sustainability and scaling results. Then in phase 2, once an intervention has been proven effective and feasible, It's critical in the second phase to systematically develop a scaling up strategy. For this, our 9-step guide and related worksheets have proven extremely useful. You'll hear from Chipo from Spark Health Africa about their support to several counties in Western Kenya applying the 9-step approach for scaling early childhood development interventions. And the third phase calls for strategically managing the scaling up process using appropriate monitoring and evaluation and adaptive management approaches. This is typically the longest phase and is unfortunately exactly when many of the early resources disappear, precisely when they're needed most. For this phase, we have a new guide in development that we hope to publish in the coming months. Now, after 15 plus years of helping implementers undertake scaling work, we've learned a lot about how to do that most effectively. For one thing, having a framework, and any framework that's based on good science is fine, it's helpful to guide what's often a very confusing process. It can help identify critical gaps that could determine success or failure. What's also clear is that the intended adopter of the intervention, what Kevin Starr and others sometimes refer to as the doer at scale, must genuinely feel ownership of the intervention and its scaling up, and see clearly how it helps them achieve their goals. Any planning activities should help this scaling process move forward. We also know that written guidance often isn't enough, and that implementers benefit from both supportive facilitation and technical assistance in applying scale-up knowledge and approaches. In fact, the 3 presenters you're about to hear from all started out themselves receiving ExpandNet-based technical assistance and are now providing that same support in their own and neighboring countries. Each of them leads what we've begun designating as ExpandNet affiliate organizations. In close collaboration with our ExpandNet affiliates and advisory council, ExpandNet Secretariat has been developing our Scale Up Learning Center, or the SLC. This will be an open access online learning and collaboration platform. You'll hear more about it later, so I'll wrap up with this invitation. If you share ExpandNet's goal of sustainable scaled development solutions, then please join us in the SLC. ExpandNet is formalizing our network, and we hope together to help shift the paradigm, provide the leadership both locally and globally to more rapidly scaling up. Thank you so much. Back to you, Jeanette.
Thank you so much, Laura. I remember when we were discussing about the first time the definition of scale up, you told me 2 things: deliberate efforts, lasting basis. Just keep that in mind whenever anyone talks about scale up. So I keep that in mind. Thanks so much. Now, we will turn to the sharing of country case experience in applying those ExpandNet and WHO guidance. And our first country experience comes from Pakistan, presented by Dr. Aris Ahmed, who leads an ExpandNet affiliate organization called the Scaling Up Accelerators. Dr. Aris brings extensive experience in scaling up and will be sharing some key lessons learned and results from the SCoP initiative, as Laura mentioned earlier. He will tell us a bit about how they actually implement their beginning with the end in mind to strengthen their sustainability and scaling up result. At the end of his remark, Dr. Aris will have a couple of questions to respond, or a couple of minutes, sorry, to respond to your questions. So please go ahead and put anything that you want to address, you want us to address as question in the chat, and he will be able to take it over. Over to you, Dr. Aris.
Thank you very much. Thank you for the introduction, Janet. Thank you. So I'm just taking over control of the slide deck, which is just coming on the screen. Yes. So I will be talking today, sharing with you our experience in Sindh province. But before that, I think I'd just like to give some of you an heads on what update on what Pakistan healthcare system is. Pakistan has a devolved healthcare system with Department of Health working for the primary and secondary tertiary healthcare, where Population Welfare Department is specifically looking after sexual and reproductive health, including family planning. We are the fifth most populous country in the world with 235 million population, divided into four provinces and two regions, Punjab, Sindh, Khyber Pakhtunkhwa, and Balochistan. Today, I'll be talking about the work that we did in Sindh under the SCoP initiative. There's a great disparity between the urban and rural sectors, and you can see that the modern contraceptive prevalence rate based on the 8-year back PDHS was 34% only, with 17% unmet need, more in the rural areas than in the urban areas. SCoP initiative was one of the pilot project that was to be a solution for peri-urban family planning services to be improved with an goal to increase 15 percentage point in 1 million population peri-urban Karachi, which is a metropolitan city, about 20 million population of Sindh province. From the diagram, you can understand it was a multi-sectoral project reaching out to many, intervention areas which could impact and the cycle approach to improve, the both access and services of family planning. I'm not going to go into detail of this, but I just wanted to give you a heads on when you talk about so what it meant to be. Uh, what we really need to understand at this stage is that so being a multi-donor funded project by Gates, Packard, Aman Foundation was not planned to engage any government of entity, health or population department, for which are basically, as I shared with you, are responsible for family planning and health services, but was more of a private sector intervention and how private sector workers improve family planning services. We were, through Gates Foundation, we were introduced to ExpandNet in early 2014, and that's, when we started discussing of how ExpandNet framework and guidance can help for developing a more sustainable and sustained model scalable by the government. And we started discussing both with our donors and the government stakeholders at the same very time to see that how we can engage them and redesign the project, because project was initially had no space for any government intervention. And we were able to achieve that understanding at some stage during the year all interventions, discussions with them. And then early in 2014, we also partners and stakeholders, which were government officials, were introduced through the ExpandNet guidance by our ExpandNet colleagues, and and they came to know what is the science of scaling up. This led to signing of the memorandum of understanding between the government and the department, and then we established a technical advisory group led by the government and begin meeting quarterly, reviewing the project at the provincial level, but also at district level. We started meeting with the same counterparts on a monthly basis. The strategy was that, the organizational processes we need to understand that could support the scaling up of high best practices through SCoP, and government ownership came slowly inside building within the model, and they asked us to see if they can. There were some pilot thoughts in their mind, and they wanted the project if they could pilot those interventions and share the results with the government. Um, as a result, the 5-year project even before it ended, with the the interventions that we had and the ExpandNet guidance, we were able to scale up throughout the province. Few interventions. I'm just naming them. The family health day intervention, which is still ongoing in the province of Sindh, the task shifting and giving the first dose to lady health workers who are the community-based, mobilizers. And they started doing the star shifting, and 20,000 lady health workers have to date been trained on that, and this is now being introduced in other provinces also. We introduced life skill based education, and thousands, nearly about I think 5,000 teachers got trained on it, and it has now become compulsory training for teachers for their promotions ahead within the government sector to have this training, and this is now part of the curriculum for standard 8, class 8, 7th and 8th students. We introduced mother and daughter counseling in the reproductive maternal child health, which is now continuing, and government on their own resources trained about 18,000 lady health workers on this. So I just wanted to share with you that, what we really had this change of mindset with ExpandNet coming into the SCoP initiative was how we can build the government and ownership. And for that, we realized that the interventions that we were doing had to be designed to fit into the government's routine system and their everyday functions, so it becomes easy for the government to understand, to internalize them and adapt them. Similarly, system integration was very important learning for us, and we tried to see that how high impact interventions which were embedded with the government existing system aligned with them, and also with the financial support that the government could allocate for them. And the last and not the least, the change that mindset which we brought was on how we can have coordination platform both at the provincial and the district level, which can discuss the implementation of these interventions and any other future intervention that come. And these platforms, even today, after 6-7 years of the project that ended, still exist. The learning doesn't end in SCoP initiative. That was one project that happened. But as Laura said in her opening remarks, that we have internalized the concept of scaling up, and SCoP framework was not only introduced in this project, but many other organizations, we guided them successfully to use this framework. In another project, delivering accelerated family planning service in Pakistan, and then another project, strengthening provincial health systems and building capacity of scale-up post-pregnancy family planning in Pakistan. This whole concept was, implemented, and we have seen many other interventions and high impact practices that are now being scaled up all across, not only in Sindh, but all across other provinces. Also, especially the post-pregnancy family planning is being scaled up in all 4 provinces. Again, the journey didn't stop there. And last week, we introduced this same guidance at our Khan Development Network. We have introduced it at many other forums, especially with FP 2030, with other countries also, to have that, sharing that understanding. Thank you for your time, and I'm looking forward for your questions that I can answer.
Yeah, that change of mindset is something very critical at the beginning. We have some questions in the chat for you.
Can I respond to them quickly?
Yes, please. If you can have, you can respond to those ones, that will be fine. Is the government of Pakistan providing financial support? Please go ahead.
Yeah. So, Julie, thank you for your question. Yes, they are. For all, as I told you that in beginning in mind, our objective has always been how the intervention is not only internalized, but how it can be supported financially. And all the intervention that I shared with you and the others in other projects are not just handovers, but government has allocated budgets and finances. Especially, even they had the new budget line item for postpartum family planning in Quetta province to make sure that it has the financial support. So that was the only question I have in my chat box. Anyone, I'm open to any other question.
There was one question for Laura, but if you want to add anything, the question was about how do you know when you move, you have enough evidence to move from guide 1, which is the piloting, the one you did, to guide 2, which is the scaling. Do you have any perspective on that?
Yeah, as I told you about these were some of the projects that the government was interested to learn about them. So, as we piloted, the special thing, as you have must have seen the framework, is how to have this resource team with you, how you develop. So technical advisory group or the provincial, committees at the district level, they were the resource team that were actually looking at the project implementation. They were doing the field visits, they were having quarterly updates, and then they were not only, they could understand, the impact that intervention was bringing and the resources that the government need to finance it. So this was a discussion, and they would tell us that we cannot afford this thing, we cannot afford HR. So what is the other plan B? So we would say, okay, existing staff, can you dedicate as someone in the existing staff? Can you train someone within the existing staff? So no, so these questions would come up. So that's when, from one pilot intervention district, they did their own pilot in another district, and then they looked at the impact, and then they went across the problems. So I think that transition times, the resource teams really makes that transition very much possible.
Thank you so much, Dr. Harris. Okay, our next presenter now is Chipo Mpure. Chipo is the Chief Operating Officer of SPARC Health Africa and ExpandNet affiliate organization as well, based in Zimbabwe and South Africa. Chipo will share the work on using ExpandNet WHO, the 9-step approach for scaling up strategy development that were used in the Western Kenya for scaling early childhood development intervention. Please, a reminder that you can still pose your question in the chat, and then we'll try as much as possible to address them at the end of the presentation of Chipo. Chipo, over to you.
Thank you so much, Chair. So my presentation outlines how we supported the Lake Region Economic Bloc of Kenya in collaboration with KMET, which is a local implementing partner, also supporting LREB, to apply the 9-step approach to developing a scaling strategy. And this led to the identification of strategic priorities for scaling multi-sectorial early childhood development interventions across the LREB counties. So our insights are drawing from baseline assessments that we conducted, midline review findings, and the Science of Scaling workshop, which was almost like the final activity that we did for this body of work. But briefly, SPARC Health Africa partners with African Ministries of Health to strengthen health systems by transforming leadership mindsets, team culture, and collaboration for sustainable public sector impact. So a bit of context in terms of what we did. So for Kenya identified early childhood development as a strategic priority at a national level because it is key for human capital development. So we worked with the Lake Region Economic Bloc, LREB for short, to scale up the Siaya County Smart Start initiative. So this initiative is a model developed by the Siaya County to improve early childhood development outcomes, which had already started registering early successes. So ECD outcomes require multi-sectorial coordination, political leadership, and sustainable systems. And the Siaya model offered a structured approach to this. So LREB has 14 counties in total, and the region decided to take on a phased approach to scaling, starting with the first 7, including Siaya County. And once that was successful, they would then go to the second phase with the remaining 7 counties. So our approach included the baseline assessments, as I mentioned, the scaling midline review, where we were looking at the scaling efforts of LREB, as well as the Science of Scaling workshop. So in terms of the baseline, what were some of the insights that we got? So we made use of the 9 steps for developing a scaling up strategy. So Laura mentioned the 3 phases. So we actually drew from the beginning of with the end in mind, as well as the 9 steps for developing a scaling up strategy. In order to design baseline assessments, as well as assess the block's scaling approach. So the baseline assessments in the 7 counties revealed a very strong foundation for scaling. There were promising emerging best practices that were coming from each of the counties. For example, in Kakamega, which is one of the counties, we found very strong data-driven governance. We also observed that most of the counties had established multi-sectorial teams, which are key when it comes to improving early childhood development. And there was also a growing understanding of ECD, the signs of ECD. However, we also noticed that there were gaps that the ExpandNet's 9-step approach helped to uncover. So this includes, for example, there was no clearly documented scaling strategy. So whereas they were scaling, there was no formal documentation that gave direction in terms of what is the scaling, the package of innovations, the resource team, how resources were going to be mobilized, how they were going to be measured. As I mentioned, there was no package of interventions which was clearly understood. There was no uniform understanding of that across the counties that we interacted with. So there was an advisory team. However, it was very limited in capacity, both in terms of the number of people that were involved. There were 2 people that were formally attached to this work from the LREB, and also KMED, the partner that was supporting them on the ground. Funding and resource mobilization were also very inadequate. And then monitoring and evaluation was not standardized. So you can see that, yes, they had identified a very good innovation to scale. However, there was the risk of the scaling not being impactful or not giving us the results that we wanted, because there were these critical aspects that were not in place, and the 9-step approach actually helped us to uncover some of those. So in terms of the workshop itself, so the baseline assessments and the midline review culminated in a 3-day signs of scaling workshop, and it included all the counties in the first phase of scaling. The workshop covered the 9 steps in detail, because we had 3 days, as well as aspects of transformative leadership principles, which are required throughout scaling. I think the previous speaker spoke about shifting mindsets. So we realized that it was important for us to also discuss what is the right mindset that is required if they are going to be embarking on this scaling journey. So there were a number of insights that came from the workshop. Firstly, there was strong political and institutional backing, and this was because of the pre-workshop efforts we had engaged in, which led to the highest office, who was the CEO of the LREB, being present. The county teams as well showed great enthusiasm for the scaling content, particularly the structured approach presented by the 9 steps. I am not sure why my presentation has come off. Okay, let me try to move to where I was. Okay, great. Sorry about that glitch. So there was a lot of enthusiasm from the workshop, and post-workshop feedback highlighted particularly the structured approach. So the 9 steps, because in the workshop itself, the teams also came to a realization that their understanding of the CIM model was quite different across the teams. And so what they were attempting to scale, the package of innovations, was quite different across teams. So this was a very good point for reflection, for them to slow down and really define what is that package of innovations. Another key insight was that, like I mentioned, it became very evident again during the workshop that there was no formal regional scaling strategy. This came out when we were discussing the innovation package, as I mentioned, with varying understanding of that package, of what it actually entailed. And also there was much focus on the governance structures, which we call the hardware of the innovation package, which spoke to the structures of the multi-sectorial coordination, but there was very limited understanding on the behavioral aspects that drove the structures. So it's easy to copy or replicate or adopt the hardware, which are the structural aspects. However, I think where there is that the secret ingredient would also be in the behavioral aspects, and yet there was limited understanding of that. There was also inconsistent documentation of the coordination mechanisms. And as I mentioned before, the resource team was limited in terms of the number of people involved in the process. So when it comes to the outcomes of the workshop, we then came up with 4 strategic priorities that would help the region be more systematic and enhance their likelihood for successful scaling, which was very critical. So the first one was around developing a regional scaling strategy. So the strategy would define the innovation package, bearing in mind that this often includes the hardware and the software aspects. It would clarify the scope and pathways for scaling. It would identify the advisory structures and standardized documentation. The second strategic priority was around strengthening advisory and capacity systems. So although there were a few people that I mentioned that were actively driving the scaling efforts, it would be key to establish a scaling advisory team. This would include political, like a diverse group of stakeholders, the politicians, and also technical champions. We would also need to strengthen the capacities of the multi-sectorial teams in specific aspects. For example, the core aspects of early childhood development around nurturing care, as well as budgeting around resource mobilization. And this could be achieved by cross-training, for example. The third priority was around financing and sustainability. We all know that funding gaps threaten sustainability. So counties were encouraged to develop resource mobilization strategies. And so this could look like coordinating funders with similar initiatives. And a good example was the work that we did with ExpandNet, which was also being supported by the Hilton Foundation. So we found common ground, brought them together, and we were able to deliver on this, this initiative, which culminated in the Science of Scaling workshop. There were also other stakeholders that were also interested in the innovations coming from the LREB. For example, the Grand Challenges Canada were just coming in to identify, using the mountain model, innovations that were promising. So again, that was one around financing and sustainability, how we could actually mobilize resources by partnering with like-minded institutions. And then finally, the last strategic priority was around data, accountability, and learning. So the monitoring and evaluation, when it came to the indicators for monitoring early childhood development, was fragmented. And so our recommendation there was a regional dashboard and common indicators that would improve visibility, accountability, and adaptive learning across counties. Finally, in closing, some of the key takeaways that I think as practitioners you might find interesting. So we learned that strategy always has to come before scale. The ExpandNet frameworks provided an easy-to-use methodology which the region could take forward. It's good that we came in at that point where they were just beginning the first phase of scaling. So they had an opportunity to actually then implement, go through the 9 steps in detail, and then, that would really strengthen their likelihood of successful scaling. This would also help in clarifying the innovation package. As I mentioned, for LREB, this was a bit of a challenge where it was not clearly defined. So being cognizant of the fact that most of the innovations require both the hardware and the software, and to be able to clearly articulate what are the software aspects that are intangible, right, that are needed for scaling. It's important to invest in leadership and behaviors. a different way of thinking is required when you talk about scale. So the way you collaborate, the way you convene as government, for example, requires you to shift your mindsets. And then finally, the issue of measurement is very important so that you can be able to see the impact of your work. So let me stop here and take any questions. Thank you.
Thanks so much, Tipo. We have a bunch of questions in the chat, but I will just ask you, there are similar questions around clarifying the innovation. People ask, what is the clear definition of innovation? If you can just try to wrap up that one. And on the other question, then we can answer them directly in the chat. So because we are still running out of time. So just try to answer the question on what innovation means clearly, and then we'll get those one, the remaining question directly to the chat. Over to you.
Thank you. So for the LREB region, the early childhood development at a national level, they identified the need for multi-sectorial coordination to be able to improve early childhood development. So innovations had to speak to how well that multi-sectorial coordination was effectively implemented on the ground. So the CIA model was very good in that it was able to identify firstly the governance structure, which was the hardware, who was going to be reporting to who, the frequency of meeting as multi-sectorial teams, who was going to be part of that multi-sectorial team. So the innovation involved being very clear on what that governance structure is and the composition of that governance structure. Secondly, I think another important part of the innovation was them to realize that the governance structure in itself is not enough. There has to be leadership behaviors that have to be exhibited. There has to be clear decision makers that are bought into the innovation so that it can be successful. So for the LREB region, it was a combination of the governance structures as well as the leadership competencies and behaviors that were needed to support that. Thank you.
Thank you so much. You may have a look at the question in the chat and also try to answer some more than directly in the chat for the participant. Thank you so much, Ipo. Now, our third country case experience will be shared by Dr. Sada Musa. I hope I'm pronouncing well the name, who leads the Development Outcome Center in Nigeria, which is also an ExpandNet affiliate organization. Dr. Sada will be sharing some key lessons learned from a work providing technical assistance to the Integrate project led by the Society for Family Health in Nigeria that actually enable real-time learning and adaptation in a government-led scale-up effort in Nigeria. Please, Dr. Sada, over to you.
Thank you very much. Thank you very much, Dina. Can I have the slides? Okay, thank you very much. So as introduced, my name is Dr. Sada Musa, and I lead the Development Outcome Center, which is an ExpandNet affiliate. I'll be sharing my experience, implementing a unique technical assistance program that is called Integrate E, and they support the country to scale a very unique and important innovation that a policy that is trying to enhance how services reach everyone through the drug shops. As you may notice, the first two presenters talk about how they use the frameworks to plan. Our experience is how we use the ExpandNet and other frameworks to escort the implementation of this scale of work by Integrate E in a kind of a participant observer format. So the Integrate E project was funded by the YES Foundation and MSD for others, and our work is funded also by the YES Foundation and is led by Management Systems International with Development Outcome Center as a country affiliate. So my presentation is going to be basically about the how we use the frameworks, not about whether the scale-up has worked or not, which is going to be part of a case study report that we are developing under the leadership of Larry Cody. So okay. So in terms of background, I think the key context, the most important context that we should look at here is how relevant drug shops, which in Nigeria we call proprietary patent medical vendors, are in Nigeria. A recent data has shown that they provide 58% of Nigerians consider them as the first source of care. And one of the key reasons why that is so is because of the complexity of our healthcare administration, which is, we operate a very decentralized system that with 3 levels of government that are semi-independent or almost independent are responsible for the health of the people. And with that, you often find some policy inconsistencies and often incongruency between policy intentions and policy outcomes. If you look at the middle frame, you realize that the number of community health extension workers is not significant enough to take care of the amount of health need at that lower level. So the huge access and gap really made the PBMVs very, very critical. Unfortunately, they are still considered as informal and not fully regulated, and there is not a very consistent way to administer their scope of practice and train them. And that is why the integrity work is very critical. Yeah, so, okay. So again, context in terms of what the innovation is a straightforward innovation where the country decided that in order to be able to, certify and integrate the PPMBs or the drug shops into the healthcare system, they need to be categorized based on their training. So they were categorized into tier 1, tier 2, and tier 3 based on their basic training. And that is really what the 3-tiered accreditation system is, which is meaningful and simple. But the challenge with scaling it is because there are so many stakeholders in the public and in the private sector that have stakes in all of this. And that really makes the scaling a very complex system transition from the private to the public and all of that. And that really makes our work to SCoP integrate E to do this scaling very relevant. So my focus on this presentation is really how we were able to use the available frameworks, mostly the ExpandNet's framework, to guide us in how we implement this technical assistance. Right, so I will do that by looking at what are the key issues we faced right from the beginning of the TA and how we were able to use the frameworks to resolve them. The first one is really the fact that when we started, not that the work has been going on for some years, for about 2 years before we started escorting them kind of. So we met a situation where there is a lot of misalignment between the scaling vision, basically because of the amount of the large number of stakeholders that involved in it. So we were able to use the ExpandNet framework and guidance tools to support, integrate E and the implementers to better translate what is the vision. So they translate the broad aspiration of national scale that is being interpreted by different institutes and institutions and individuals into a more unified scaling vision that specifically said where they will leave the country at and what will the country need to do going forward to be able to scale this work nationally. So the second issue we face also was the fact that the three-tiered accreditation system was not really designed originally with a systematic framework in mind. So it was a bit challenging for us to come in and put in some structured adaptive management system that will track over time. So we had to work backwards and use the ExpandNet framework to map the key components of the three-tiered accreditation system scale up into the different components of the ExpandNet framework. And everyone who is familiar with the ExpandNet scaling framework will understand how we're able to map all of these different components. So with this, we're able to put in how we could track it prospectively, which I will explain later in the next slide. So the key and another issue we face in terms of the wide geographical spread of this work. Nigeria is a very big country, and there are 11 states where integrity is working with various stakeholders implementing different kind of works there. So it was a big challenge with our small team tracking in real time what is happening everywhere. So what we did was, having had the initial mapping that the ExpandNet framework allowed us to do, we use M&E systems framework to be able to define what is the logic of scale. So from the theory of scale, we work backward to define what are those key assumptions that are made in how output that the project creating changes within the communities, and working back to say what are those key processes and what is the assumption of the theory of action. What are those assumptions where activities or the process of the projects are producing outputs which will now create the changes within the community that we expect to see scale. With that, we were able to develop an adaptation tracker, as well as a learning agenda that we use on a regular basis, on a monthly basis, on several virtual meetings with the state level and national level implementers to be able to track the adaptations. So lastly, one other issue we faced was that the twin objectives of what we're doing. The twin objectives we were focusing on is, on the one side, documenting what is happening, which, as I said, we are going to produce detailed case study reports that will inform the scaling community of this unique way of doing, of scaling, but also holding a mirror to Integrate E to say, this is where you are, and this is what you need to do. They will now look at what we provided and say, clearly see what they need to do. But beyond integrity is also the government stakeholders. And it's sometimes challenging how you share information when it is not just about delivery of, of project outcomes. It is more about how hidden assumptions are being realized or not, feedback loops and all of those, how the system is responding. So with that, we use the MSI developed institutionalization maturity tracker to be able to objectively gauge where the scale-up stands at any time along the institutionalization continuum. We then use that to share with the implementers and the government at opportune decision times, so that they could be able to see what needs to change, what adjustment they need to do in order to advance the scale up of this work. What is in the screen at the center is really one of the presentation we made at one of the high-level meetings. So the last slide I have is really a conclusion. We can confidently say a technical assistant like this will support real-time learning and accelerate adaptation. But three things must happen. One of them is there has to be a kind of way it is systematic. Even if the scale is not designed in a way, systematic way, there is a need to define what organizing frameworks to be used, so that adaptive management is, can be implemented. That is one. The second thing is that such TA need to be what I said earlier, participant observer, a kind of inside, outside participant that will be inside not to understand what's happening, but also outside to provide a neutral view of the bigger picture. But it also needs to be a decision-oriented kind of TA, where we look at the opportune moment to provide suggestions that can inform decision making. So thank you very much, Jeanette.
Thank you so much, Dr. Sarah. Thank you so much. Thank you. There are one or two questions in the chat box. Maybe you can try as much as possible to respond directly, as we are running a bit out of time. And participants can also interact with you when we go to the breakout room. Now that we have heard about this 3-country experience with applying the ExpandNet WHO framework and guidance in different way, in a different point of time, it's time to bring you all in to be part of the conversation. We will be moving into breakout room for the next 10 minutes, where we'll be able to choose which topic you would like to discuss more. We have four rooms. The first room is a space where those who need or prefer to speak in French can have the discussion about whichever of the phases of scale-up they prefer. And it will be facilitated by myself and Dr. Shersek, who leads the ExpandNet affiliate work in Francophone West Africa. The second room will discuss the beginning with the end in mind phase of scale-up, and will be facilitated by Dr. Arif, that you just heard, and Jennifer Gale, who has a great experience, experience applying the guidance with country team in DRC, Niger, and Mali. The third room will focus on scaling up strategy development, will be facilitated by Laura and the SPAC Health Africa team, Chipo and Tendai. And we'll have a fourth room on documenting real-time learning using adaptive management to work with government-led scaling effort, and of course that will be facilitated by Dr. Salah and Femi from the DOS Center team. So we will come back to the plenary once we finish with the breakout room and do some quick debrief. Now I'm going to call on Gabby to help us ensure that all participants can select the room. Now, what we want to do is we would love to hear from some highlight from the facilitators of each group, but in the chat, if each of the facilitators can put what are the biggest takeaway from each of the discussion, share, Aris, Tendai, Shipo, Laura, Sada, please go ahead and give us some highlight on in the chat for whatever happened, unless we can take one directly. If I think terms allow us to take one, I can just have share quickly and maybe one another to give us briefly key highlight. Share, do you want to go? Just one highlight from the group. No. Oh, I can't see the chat right now, so maybe people are writing the chat. Aris, okay, please go ahead.
The learning that we had was very interesting, and I think the participants appreciated that the fact that a proposal written, close, implemented can still be we can go back and make those changes to ensure that the right stakeholders are there who can take that impact. And I think that was a good learning there. And there was a question that if we wouldn't have done that, what would we have the other norm would be? So that and the answer was there wouldn't be any other norm, because it would just have been, a project that would have done well and closed. So that was the one thing that came out from the discussion.
Okay, thank you so much. I think
Je peux y aller, c'est bon.
Oui, rapidement, cher, très rapidement.
Merci, Julien. Donc, pour le groupe francophone, nous étions dans de belles discussions. Ça a tout coupé rapidement. Mais d'abord, ce dont on a discuté, c'est comment, les précoces, c'était comment différencier l'innovation de ce qu'on va mettre à échelle. L'innovation primaire de ce qu'on va mettre à échelle. Aussi, le potentiel de mise à échelle de l'innovation. Est-ce que souvent, il fait l'objet d'une évaluation préalable? Et la documentation aussi. Le groupe a discuté que ça manque beaucoup, ça a été évoqué, la documentation de la mise à échelle. Mais on est aussi revenu sur le point de la définition en français de la mise à échelle. Donc, l'anglais dit tout simplement scaling up, alors que pour le français, c'est mise à échelle, passage à grande échelle, passage à échelle. Et tout ça, nous autres francophones, il faudra qu'on essaie de mettre un peu d'ordre. Même si on est vers ExpandNet, on a vers le Scaling Up Learning Center, on va parler de mise à échelle et de passage à échelle. Merci, Jeanette.
Thank you so much, Jane. That highlights some of the discussion that we already have internally with Laura at some point, trying to find the best way to actually say what is scale up in French. So, but anyway, I think the most important is that we all agree on the content of what it is. Then the semantic can come later on. All right, then that's summarized for us the breakout discussion now. I would like to shift to our final presentation, where we will now turn to Pratima, who works with the partner in expanding health and quality and access to support ExpandNet as well as the Council and Secretariat. Pratima will be previewing us the ExpandNet forthcoming online platform. That's really something I'm really excited about, the Scale Up Learning Center, and I hope you will enjoy it. Pratima, over to you.
Thank you so much, Jeanette. We would now like to share a preview of ExpandNet's forthcoming Scale Up Learning Center, or SLC. The SLC is an open access learning and collaboration platform where global health and development professionals can gain a deeper understanding of scale-up from ExpandNet's perspective and experience base. Created in collaboration with ExpandNet's Global Advisory Council, the SLC offers engaging interactive content, personalized learning pathways, and opportunities to connect with other learners and experienced ExpandNet leaders and facilitators like those you've heard from today. The SLC aims to foster a vibrant global learning community of people who want to build their expertise in scaling up to drive sustainable impact at national, regional, and global levels. In many ways, the SLC reflects ExpandNet's broader contribution to the field by helping implementers shift scale up from ad hoc approaches toward a more deliberate, systematic, and systems-oriented process. The SLC weaves together practical scaling experience of ExpandNet members from around the world with ExpandNet's evidence-based guidance, making scale-up knowledgeable accessible to everyone working across global health, development, and climate change. Throughout the SLC design process, our team has kept a few key things in mind. We wanted to ensure the platform would be easy to navigate, available in multiple formats and languages, and optimized for low bandwidth use. So now for a preview beginning on our landing page. I'll pause for a moment while that landing page comes up.
Can you see it?
Yes, thank you, Laura.
Good. Okay.
So while the SLC will be published first in English, we plan to launch a French version soon after, followed by Spanish, Portuguese, and hopefully Arabic. The homepage provides an overview of the SLC curriculum. As you can see, there are 5 SLC modules. They explore ExpandNet's history, key scaling concepts, and global learnings, and are organized around the 3 phases of the systematic approach to scaling that Laura previously shared. Each module contains videos and interview clips, applied exercises, slide decks, case studies, and recommended additional readings. If you would like to learn more about the SLC curriculum, this page shows the module summaries and learning objectives.
Learners can then review and choose from 3 learning tracks: the certificate track, the self-guided track, or the team track. Once learners choose their track, they need to register and sign a learner agreement, and then they can begin accessing the modules. So once inside the site, learners will arrive at a dashboard page. On the left-hand vertical menu bar, learners can track their progress and receive notifications and navigate the platform. From here, I'd like to preview the introductory module, which shares ExpandNet's history and key scale-up concepts. You'll see an outline of the module's 9 lessons, along with a country case study. Learners can click on a lesson and engage with the content in 2 main ways. Perfect. Learners can watch the video with the slides as previewed here, or read the transcript below. Audio recordings of the lessons are also available, which is a good way to take in the learnings a second time to reinforce concepts and learnings. We will now share a highlight of a lesson video. In consultation with ExpandNet's Advisory Council, we decided to use AI narration to offer a broadly understood accent.
Here is a senior government leader, Dr. Coyote Afolabi, sharing his perspective about the value of participating in an ExpandNet Scaling Up Orientation workshop during his time as the Director of Reproductive Health for the Nigerian Federal Ministry of Health.
And I want to recommend for every Ministry of Health in different countries to support their public health experts and of course other health experts to have this training, especially when it becomes available on a wide scale through online approach.
Many SLC lessons include video interviews with scale-up implementers from different countries. After completing a lesson, learners respond to short answer reflection questions and a learning check or quiz. At the end of each module, there's a formal assessment. So I'll pause the preview here to share that we expect to begin publicly rolling out the first 3 modules in the coming few months, and by mid-2026, we hope to publish the remaining 2 modules when they're ready. We recently published a pre-registration site where individuals can learn more about the SLC and also sign up to be notified of the SLC's launch. We will put a link to the pre-registration page in the chat. So ExpandNet Secretariat and Advisory Council are eager for ExpandNet learnings to be shared widely with the global health, development, and climate communities. Our goal is to make foundational scale-up learning accessible across the globe, as we believe the SLC has a very important role to play in achieving that goal. Thank you so much, and we look forward to hopefully meeting you in the SLC. I'll now turn it back to Jeanette.
Thank you so much. I think now we are getting closer to the end of the panel. As we come to the end, I would like to thank all speakers for sharing their expertise, but also for all of the participants for the engagement. I thought it would be nice before we depart, everyone, that we hear from our 3 co-chairs of the Health Technical Working Group, Dr. Moji from Nigeria, Tendai, and Laura. Each of them will offer 1 quick minute of reflection, then I will close. Over to you, Moji.
Thanks so much. So much robust and learnings within the short time. What's bubbling up clearly for us as a community is the key gems and elements or nuggets, as I'll call it, for successful scaling. It is clear that we need to define innovation packages, clarifying, and it's not a one-time fix-all. It has to be continuous clarification and building consensus with key stakeholders on the elements, because what we consider as innovation in one geography may be different in another geography. It's also important for us to be intentional in incorporating behavioral science elements into the scaling up, especially in shifting mindsets at the leadership level. And leadership here is at all levels. It's not just at the policy leadership level. This will be a secret sauce, you know, for successful scaling. Robust documentation is also key, and the soft side documentation and the hard side, which means qualitative and quantitative. And so that robust learning will bring learnings, you know, with evidence, because often we get asked questions and then we say it's difficult to measure, but when we're intentional, you know, having like the anthropologists deploy in documenting those soft side experiences, it's important for us to continue to deepen that. Lastly, building strategic partnership cannot be overemphasized because this is a major resource in sustainable scaling of whatever innovations that we have agreed to. And of course, through the org, adaptive learning and management is a cross-cutting element that continue to nurture insights, you know, and help in that journey. Thanks for presenting the SLC. These discussions need more series, but this is a beginning of what I think we should continue to fine-tune in this new year. Over to you, Jeanette. Thanks for offering me that 1 minute insight time.
Thank you so much, Moji. I think we are almost there now. I'll ask Laura to say something before I close. Just 1 second. Laura, if you would like to come in, and then I'll close. We can't hear you, Laura.
Sorry, I'm here. Thank you, Jeanette. Yeah, we've heard such rich experience today reflecting on how people have used ExpandNet guidance for meaningful outcomes in terms of process and planning processes. So there's many more examples on the ExpandNet website, and we really do hope and warmly welcome everybody to join us in the Scale Up Learning Center and to share your learnings on scaling up with others. And so thank you everybody so much for this incredible opportunity. And we appreciate you being here, and please continue coming back. And thank you, Jeanette, for the amazing moderation.
Thank you so much, and thanks to everyone. And we count on you, every one of you, to spread the word around the SLC, which is really something very critical we are trying to build. Thank you so much. Thanks to all presenters, participants, and yeah, see you next. Thank you. Bye.